watching TV9 Digital. I'm Neha. In the last few days, India has witnessed an overall decline in the number of coronavirus cases. The numbers, more or less, have remained under 3 lakh for over a week. This begs the question if we have already seen the crest of the second wave of this deadly virus. If yes, why aren't we witnessing the same trend across all the states? Most importantly, remember that there has been a gradual shift of the virus from the major cities to the rural areas of the country. These areas are more vulnerable to the virus because of the lack of adequate healthcare facilities and can prove to be much more troublesome to tackle. To understand about this in depth, I spoke to public health expert Dr. Vivekananda Jha a little while ago. Welcome, Dr. Vivekananda Jha. My first question to you would be, sir, given that the number of cases have been showing a declining trend over the past couple of days, would you say that we've already passed the second peak of coronavirus pandemic in India?
Thank you for inviting me. So indeed, that seems to be the case. From the reported numbers, there seems to be a consistent decline in most parts of India in the number of cases that are being reported, at least official numbers. But more importantly, from our discussions with colleagues who are managing COVID hospitals, we can confirm that the number of hospitalized cases also is coming down. But the number of cases who are still in ICU is still high, and that will take some time because there is always a lag between the number of infections coming down and the number of people who manifest severe disease.
If that's the case, Dr. Jha, why are we not witnessing the same trend across all the states in India?
Well, we don't know the answer to that because there is still a lot unknown in this pandemic. So if I expand on my earlier answer, we don't know what is happening in rural India, for example, in many states. And it is possible that where the spread has occurred late and it has not been contained to the extent that it has been in some states with localized lockdowns, statewide lockdowns, citywide lockdowns. There the spread is still continuing, and therefore the numbers have not come down to the extent that they have in some other locations.
Okay, which brings to me my third question that, as you rightly said, that the second wave seems to be waning, but across all the major cities, of course, but still is growing in the rural areas of the country. By claiming that the second wave is past its prime, aren't we creating a false sense of security?
Well, no, it's a statement of fact. If the cases are coming down, we should say that the cases are coming down. But this is not to say that this is linked with our need to lower the guard. We should definitely not lower the guard, which is a lesson that we have learned painfully over the last 6 months. So unless and until we have a large proportion of our population vaccinated, we will need to continue to have our guard up and maintain all the precautions. And this is a message that we should consistently give to all the people who are still at risk, which means a majority of Indian population, and also tell all the people that if you have access to a vaccine, go and get it.
Dr. Jha, considering the lack of adequate health facilities in the rural area, the number of cases can literally blow out of proportion, blow up in the villages. So isn't it extremely important to ramp up testing in the rural districts and blocks before claiming that the threat has subsided?
Of course, we should take an integrated approach to health service delivery, which includes maintenance of appropriate health system messaging, health service messaging regarding precautions that people need to take. But we need to also combine it with appropriate testing, tracing, etc., and giving people the opportunity to also protect themselves and those who get the infection to quarantine. So those points are all well made, and we need to do that. But what one can say with some degree of confidence is that the overall number of cases that are reporting to health systems right now, which means COVID facilities, is coming down. We of course need to do a lot more in our rural areas.
Absolutely, sir. Couldn't agree more. Lastly, I'd like to ask you, Dr. Jha, compared to the first wave, the second wave stands out for the virus's mutations, its variants, and of course its spread and the deadlines and the deadliness, beg your pardon. But do you think that we'll ever see the second wave die down completely or not?
So look, we have to agree and recognize the fact that we are not never going to go to a situation which is called as COVID zero, where there will be no COVID, right? So there will be some COVID in the community almost always. But what is that level of COVID transmission in the community, the residual transmission? That is to some extent upon us. When I say us, I don't mean just leaving it to the population, but with the entire health system and also the political response system, the administrative response system that can determine. So, and the goal is also not to continue to stay locked up until all COVID cases go and we have not a single case. So there will be some degree of mild COVID transmission, endemic COVID transmission, like we have for many conditions. We will have to learn to live with it, but it should be manageable. It should be at an acceptable level, because there is always a cost to achieving some public health benefit. And what is the cost that the society is prepared to accept is something that's important for us to discuss.
The only way to make sure the lingering virus threat is obliterated is through intensive testing, tracing and treatment, something that the government has been asking the states to focus on, especially in the rural areas. Let's all be careful and safe and play our role in beating the COVID-19 for good. Thank you very much for joining me. If at all you've liked the information that I've shared, do not forget to subscribe to TV9 Digital across all social media platforms. Stay safe, keep those masks on.